Today we will discuss healthcare costs, patient access challenges by examining affordability across the entire health insurance marketplace. This hearing builds on work Republicans have done in this Congress to address healthcare affordability. We plan to have future hearings with other leaders and experts across the healthcare continuum to understand the root causes of rising healthcare costs. Specifically, this hearing will focus on the role insurers play in the delivery of care. The insurance market is dominated by a handful of Fortune 50 companies that control the majority of the national market. In some states, a single insurer may even control 80 or 90% of a particular market. The biggest health insurers today often manage several facets of the healthcare supply chain, such as owning the pharmacy benefit managers, the group purchasing organizations, multiple provider groups, and specialty or mail-order pharmacies. Even with owning those, complicated benefit designs, narrow networks, prior authorization requirements, and opaque coverage decisions often leave patients feeling like they are paying more for less. The market also lacks transparency and is not easily navigable. One contributor to health insurance unaffordability for millions of Americans is the so-called Affordable Care Act, also known as Obamacare, that was signed into law in 2010. When Democrats passed Obamacare without Republican support, they sold the bill on the promises that premiums would fall, competition would rise, and if you like your insurance plan, you can keep it. Instead, Obamacare has increased healthcare costs, warped incentives, federalized benefit, restricted plan design, and limited access to care. Many patients have fewer plan choices than they did before Obamacare was enacted. In fact, a constituent of mine told me recently that his family only had one provider option in the Obamacare exchanges. Therefore, Obamacare coverage is not translating to patient or taxpayer affordability. Unfortunately, employer-sponsored insurance is also becoming unaffordable, and each year more American small businesses choose not to offer health insurance because it is too costly. This impacts the ability for a small business to be competitive and to attract talent. We know two things are true. Competition is essential for patient access. Lack of competition and consolidation within the insurance marketplace has led us to higher healthcare costs as a whole. The healthcare system needs to work for patients. That means empowering individuals with real choices, transparent prices, and coverage that fits their needs. We must strive to have more competitive plan options that reward quality and focus on affordability, access, and outcomes. Our discussion today is meant to move beyond politics and spur debate about how we can work toward delivering meaningful, innovative solutions for the Americans that we all serve. We owe it to patients to get to the root cause of the challenges we see across the health sector, and I look forward to hearing from our witnesses.